Welcome to my presentation on the Metformin clinical trial for individuals with Fragile X syndrome. I'm François Borduc, I'm a pediatric neurologist at the University of Alberta, and I'll be talking today about our upcoming clinical trial using the drug Metformin in Fragile X syndrome. Our main objectives for the talk today are to review how research in Fragile X syndrome has led to the discovery of the role of metformin potentially in Fragile X syndrome, and then on the details of our clinical trial with metformin in Fragile X syndrome. One thing I think that's really important to talk about is the fact that we need to go beyond the focus solely on the gene and the pathways and the molecular aspect and turn into an approach that's more oriented toward the functional impacts of our intervention, be it pharmacological or non-pharmacological intervention for individual with Fragile X, but also for individual with other causes for neurodevelopmental disabilities. And therefore, it's really important within this trial and in our research in general to consider how meaningful impact can be achieved using all sorts of intervention. Another really important aspect for us is to consider that there is not a single molecule or a single intervention which will resolve all the issues, symptoms, or signs that we see associated with neurodevelopmental disabilities. There's no panacea. There is not a molecule that will respond equally for everyone and that will have the same profile of side effects for everyone. And I think this underlies the idea of neurodiversity, which we see in the general population, which includes individuals with neurodevelopmental disability, including Fragile X syndrome. So what we're trying to do in this trial is not only recognize that, but also try to understand the molecular basis and the genetic basis and the epigenetic factors that could be involved in this variation between individuals to try to understand better intervention effect and intervention allocation to different individuals. So to find basically the best fit for each individual in terms of intervention. So let's try by looking at how research came in the animal model and then in human to identify a potential role for metformin in individuals with Fragile X syndrome. In our lab, we study learning and memory, and we want to study learning memory in consideration of genetic effects. So we use a very simple model called the fruit fly, Drosophila, and we basically use flies that have mutation in different genes and then study how they can learn a new task, which is to combine the memory of a smell with a foot shock. And that association flies are able to remember for several weeks actually has been very useful actually to understand the molecular basis of Fragile X syndrome and many other genes as well. Back in 2016, we found that metformin actually had a positive effect on memory, short-term and long-term memory. This is showing the short-term memory improvement that we see in fruit flies that have a deletion of the Fragile X gene. So flies that do not express the Fragile X protein have a learning defect, which can be partially improved by metformin. Next here, we see that this defect in short-term memory is also associated with a defect in long-term memory in flies that have deletion of the Fragile X gene. And what we see is that metformin again has a positive effect on their performance of remembering these association and when taken even just for a few hours prior to the training. What we see also is that the rescue is not completely back to the wild-type performance, or the flies that do not have a deletion in the Fragile gene. And this is important to recognize, because we think that the molecular changes that are occurring with metformin in these flies is not correcting all the other previous defect, and tells us that there is multiple aspects to be considered when doing a clinical trial as well. Here we see that this improvement in memory that we saw in flies is also seen in mice. And I won't go into all the details of that publication, but using a mice model this time where the Fragile X gene is deleted, we see that they have some changes in the ability to learn new information, and this is a paradigm known as long-term depression. And what we see here is that in the panel J is that memory is actually rescued when mice have been treated with metformin. We also see that there is some molecular changes that we see in Fragile X that are corrected by using metformin in these mice. So that's showing us that this is an effect that's occurring at the molecular level in the cells of the brain of these mice, which is very promising, very encouraging. Well, the most important was to see, are these findings only seen in animals, or can they also be seen in patients? And so one of our collaborators, Dr. Andy Agerman at the Mind Institute, initiated an open label study with a patient with Fragile X syndrome of metformin. And so what she did is she initiated treatment in 7 individuals with Fragile X syndrome, and she noted that there was an improvement in irritability, social responsiveness, hyperactivity, also social avoidance. But what was striking is that most of families actually reported that the expressive language ability of the patient all improved, which was not studied as thoroughly previously and led to this clinical trial. So we wondered, how should we assess then the treatment with metformin or placebo in Fragile X syndrome? What would be the best way to approach the treatment to make sure that we can measure real potential effect of the medication? We considered how to improve on the way that clinical trials are done, especially with Fragile X syndromes. So we identified 3 main objectives. First one being to consider objective outcome measures, so performance-based tasks where individuals are asked to perform a task and not related to only questionnaires appreciation. The second one is it is important to have an increased number of participants into the trial, so that even if there's variability between individuals, there'll be enough of each type of individual to be able to have statistical measures that are valid. And then the third one is that we really want to define patients beyond a single gene diagnosis, in this case Fragile X syndrome diagnosis, exactly because there is a lot of variability between individuals. Some have more difficulties with some aspects and some have strength in other aspects. So we want to define that using multiple measures, including cognitive measures, but also measures of variation in DNA, variation in proteins, and variation in RNA. So we developed a study with 60 participants per site. There's 3 sites. There's UC Davis, Mind Institute with Randy Agerman. There's Edmonton in Alberta, Canada with me, François Bolduc. And then there is Montreal St. Justine Hospital with Dr. Sébastien Jacquemont. The patient or the individual participant will actually receive either metformin or placebo for 4 months. There will be 3 visits at the site, and then multiple phone calls in between the visits to make sure that there is no side effects, or if there's any other issues to discuss, that the families can discuss that directly with the investigators. Like for any study, it's really important to make sure that the participants are grouped in some inclusion criteria. And so the individual for this trial must have the Fragile X syndrome as defined by mutation in the Fragile X gene with CGG repeat more than 200 copies. The individuals can be male or female between the age of 6 and 25 years old. There's a full list of detailed criteria here, but it is really important for us that there will be family and caregivers very involved, as there is performance tasks performed by the individual, but also we want the input of families in terms of the response with various questionnaires which will be done throughout the trial. The participants will speak either French or English because of the tasks that are being used, and they'll have to be stable on their medication and intervention prior to entering the trial to make sure there's no confounding factor. The IQ of the individual will be tested and will have to be no higher than 79 for this study. And the rationale for this being that we want to make sure that individuals may benefit from the medication and are not already showing a performance on the task that is too high to be captured by the tools used to measure in this trial. They'll also be able to speak in 3-word sentences at least occasionally, and this is important because, as you'll see, the primary outcome measure will be around being able to speak in more words. So having no words we felt would be challenging, but individual will have to have some words for the trial. We'll also have to have criteria of exclusion, and those are basically reverse of what the inclusions are in most cases, except a few exceptions. So I'll go over that here. So an individual that is not collaborative will have challenge performing the task and therefore cannot be included. If somebody has life-threatening medical condition, also will not be able to be included in the trial. If an individual is younger than 6 or older than 25, they won't be able to be included in the trial. Now, for individuals younger than 6, keep in mind that the trial lasts for 3 years, and so if they are just about to be turning 6, that could be an option to be included in the future. It's also important to recognize that metformin can lead to weight loss in individual with obesity, which could be a benefit, but we wanted to make sure that individual of normal weight will not lose weight. So far it seems that they are not, but this will be studied carefully in the trial, and therefore individual with a BMI less than 2 standard deviation below normal won't be included at this time. Metformin has very little in terms of side effects that are serious, but can lead to severe lactic acidosis in individuals with kidney problems, which is not seen usually in Fragile X syndrome, but we will be measuring the creatinine level, which is a measure of kidney function in all individuals, and we'll be monitoring that, as well as lactic acid, as this could be a very serious adverse event. We're also going to measure B12 vitamin to make sure there's no B12 deficiency, which could lead to more risk of anemia in individual taking metformin. It is important also, as this is a trial, that individuals are not pregnant during the trial, and therefore we will be assessing for pregnancy at screening, but also at later time point. As mentioned, individual with an IQ less than 79, higher than 79 won't be able to be included in this trial, but we are considering potentially future trial for individual with higher IQs to be able to try the metformin or placebo trial. As I mentioned previous slide, metformin is usually well tolerated. It's been used extensively in children, in adults for diabetes, but one of the common side effects that is seen is gastrointestinal complaint, either of stomach pain or abdominal pain or diarrhea. So the protocol therapy will be initiating metformin at at the lowest dose of 250 milligram at week 1, and then we'll be going up progressively up to week 4 in order to limit these side effects. There will be a dosage for individual less than 50 kilogram and another dosage for individual more than 50 kilogram. So what would participants do in this trial? Well, one of the important pieces is to consider objective outcome measure. So one of the main aspects noted in the open label trial, as I mentioned at the beginning by Dr. Ackerman, was that individual had improvement in their language. And so there's a task that's been developed at the UC Davis Mind Institute by Dr. Lena Beduto that involves expressive language sampling. And this is a task where there's a conversation between the examiner and the participant on a topic that is selected by the participants, by the individual with Fragile X. There's also a narrative piece where the participant tells the examiner about a story from a book that contains only pictures and is allowed to talk freely about the story that is seen there. This will be our primary outcome measure, and this is very important to us because it has a very direct functional impact into the activity of daily living, but also in terms of improving communication and limiting other issues with frustration, challenging behavior, for instance. So one of the main aspects noted in the open label trial, as I mentioned at the beginning by Dr. Ackerman, was that individual had improvement in their language. And so there's a task that's been developed at the UC Davis Mind Institute by Dr. Lena Beduto that involves expressive language sampling. And this is a task where there's a conversation between the examiner and the participant on a topic that is selected by the participants, by the individual with Fragile X. There's also a narrative piece where the participant tells the examiner about a story from a book that contains only pictures and is allowed to talk freely about the story that is seen there. This will be our primary outcome measure, and this is very important to us because it has a very direct functional impact into the activity of daily living, but also in terms of improving communication and limiting other issues with frustration, challenging behavior, for instance. You may wonder if this task has been shown before, and it has actually been recently used in the language intervention. And in red, you can see that post-intervention, individual that received the intervention improved significantly compared to their baseline level, whereas individual without intervention actually did not have a significant improvement, telling us that this task actually can discern intervention responsiveness, but also does not seem to have a significant placebo effect in the post-treatment when there is no intervention given. Another task that will be done involves the NIH toolbox. The NIH toolbox is going to be used because it's a test that has been developed and standardized to assess multiple brain function, and therefore functions such as memory or association will be tested with 8 subtests based on an iPad. The children and young individual tend to love interacting with the iPad, as you know, and so this task is very much liked, and individuals tend to participate more than a task done on paper, for instance. The next task is a test for long-term memory using a tablet again, online memory testing. And for this, a task that we developed in our lab, individuals are asked to remember pairs of objects. For instance, individual may be asked to remember that a line goes with a ribbon, and then will be shown this picture for a few seconds before they are shown another set of association. At the end of their training, they will be then asked to match the pictures that go together. This will be done right away after their training, but the advantage of doing it online will be that it also allows us to test it the next day and see if their memory retention is good or if there is a decline in their memory over time. Another task involves the measure of eye tracking with individual with Fragile X or individual with typical development as shown here. So as you can see, the eye tracker will record where the individual put their eyes and focus on the face here. And as been published here, individuals with Fragile X tend to have a gaze aversion to the eyes, which is felt to be related to anxiety in many cases. So the trial will be assessing the impact of metformin or placebo on this ability of refocusing to the eye level. As I mentioned earlier, a very important point also is to include sufficient number of participants to be able to see responsiveness even with variation between individuals. So we've assembled a fantastic team between the US and Canada, between UC Davis in Sacramento with Len Abeduto and Randy Eggerman, as well as David Hessel, Edmonton site with our team, and then the Montreal team with Sébastien Jacquemont and Sarah Lippé. Our site will be a center for referral for the western part of Canada. So we have been working very closely with Dr. Billy Aud and Dr. Cara Murias at the Alberta Children's Hospital to recruit individuals from the southern part of Alberta. We're also working very closely with Dr. Elena Lopez from the BC Children's Hospital, and who will be able to also refer patients to the trial. We're currently working also on collaboration with Saskatchewan and Manitoba, and we'll be happy to have individuals coming from all these sites as we've budgeted funding for transportation for the families. Finally, it's really important to better understand why individuals with Fragile X vary between themselves and how is that influencing the response to intervention, either pharmacological or non-pharmacological intervention. So we'll be using a multiple level of analysis and sampling for that in each individual with Fragile X to better understand the genomic changes, the change in gene expression, the changes in important protein, but also the change in gut microbiome, for instance. And with that, we hope that we will gain a better understanding of Fragile X syndrome to start with, but also the response to potential treatment, metformin, but potentially other treatment to come in the future as well. So in summary, Fragile X syndrome is a protein that regulates protein synthesis and has been associated with the insulin signaling pathway in animal model, and has shown a conserved effect of metformin in individual with Fragile X syndrome, but also in flies and mice with gene deletion of the same gene. But what's really important going forward is to understand better why some individual with Fragile X syndrome may respond to metformin and why some other individual may not respond to metformin, and try to correlate that with specific biomarkers or markers of biological response. And this is really what the trial is aimed at, is not only assessing the response to metformin, but creating a legacy of biobank and data about individuals, so that for those who want, their contribution could last in the future for our lab, but other labs as well, all focused on Fragile X syndrome. Also, I'd like to mention that we are already planning the second Alberta Neurodevelopmental Neuroscience meeting. First one having occurred last summer, and we're planning for fall 2019, probably in Calgary. And so please stay tuned to the Fragile X Alberta and the Fragile X Edmonton Facebook page for more details. As you can see, there's a lot of people involved in this research. We'd like to thank the Azrieli Foundation, who provided the funding, the Stollery Children's Hospital as well, and all the individuals there that participated in the research that led to the discovery of the impact of metformin and Fragile X syndrome in the fruit flies, and also in human. I'd like also to thank the members of our clinical trial team, Megan and Carrie, as well as Tracy and Jonathan, for their help with putting the trial together at our site. We also have several collaborations using artificial intelligence to try to better understand how various biomarkers could be utilized in the future for better understanding treatment and intervention. And so I'd like to thank them all. I'd like to thank you for your attention. Please contact us if you have any question, either by visiting our Facebook page at Fragilex Edmonton, or by contacting our research coordination team at 780-492-9461 and leaving us a message. We'll be happy to call you back. Thank you for your attention again, and see you soon. Bye-bye.